I want to begin by thanking my colleague and friend from across the Big Sandy that divides Kentucky and West Virginia, and my good friend across the aisle, Nick Rahal, for organizing these special orders by the Congressional Caucus on Prescription Drug Abuse. Congress, the DEA, the medical community, state partners, and particularly the Federal Drug Administration must do more to fight the medicine cabinet epidemic. The Office of National Drug Control Policy in the White House has identified prescription drugs as our nation's fastest growing drug problem, easily eclipsing cocaine and heroin abuse. As has been said, the National Center for Disease Control has said that prescription drug abuse is now a national epidemic. In 2010, 254 million prescriptions for opioids were filled in this country. That's enough painkillers to medicate every American adult around the clock for a month. Our military soldiers are coming back from Iraq and Afghanistan hooked on these pain pills. In the last 2 years, over 150 of our soldiers have died from overdoses. In my home state, Kentucky's losing roughly 82 people a month to prescription drug deaths, more than car crashes. Our medicine cabinets are more dangerous than our cars. But these statistics, of course, are just numbers. So many Americans, including members of our caucus, who've taken to the House floor today, have been touched by this tragedy in some personal way. In some counties in my district, half of the children are living in a home without their parents, in large part because of prescription drug abuse. I've met single moms struggling to get through drug court, and employers who can't string together a clean workforce. We've lost mothers, we've lost grandfathers, police officers, children, brothers and sisters, husbands and wives. This epidemic does not distinguish between socioeconomic lines, or gender lines, or geographic lines. It's indiscriminate in its path of destruction, and it has to stop. FDA has to be part of saying no to the abuse of legal drugs. FDA is the primary entity for regulating prescription drugs with its hands on the spigot. For years, I've pleaded with the FDA to take a harder look at how these painkillers are allowed to be prescribed. Congressman Frank Wolf, Virginia, and I have implored FDA to make these painkillers available only for severe pain. Prescription painkillers such as OxyContin and Opana were originally intended to treat severe pain caused by cancer. But over the years, based in large part on marketing practices, many physicians, dentists, other healthcare providers began prescribing opioid painkillers for moderate to severe pain. A toothache or a stubbed toe has become an excuse for an oxy prescription. Now, OxyContin's a wonderful drug, intended for terminally ill cancer patients, people in severe pain that needed a time-release capsule over 12 hours. It helped the patient and helped the caregiver. But it's also a very addictive drug and very difficult to kick once addicted. So this is really a dangerous drug when not used in the prescribed way. This FDA-approved indication for moderate to severe pain can create the false assumption that opioids are a safe and effective treatment for chronic non-cancer pain. On the contrary, more than 30 leading clinicians, researchers, and health officials recently petitioned the FDA to strike the term moderate from the indication for non-cancer pain, add a maximum daily dose and a maximum duration of 90 days for continuous daily use. When we're losing 16,000 people a year to these drugs, the FDA must take this petition seriously. And Mr. Speaker, I yield back the balance of my time.